No.
Okay.
Not by itself, and it's very difficult to grow bone vertically.
So yeah, probably then go to the implants is what you've talked about.
Well, if it gets real bad, but I tell you, if we get the opportunity, which we like to do, is to catch you early enough to treat it and control it, because once you get gum disease, you always have gum disease.
It never goes away then for good.
Never goes away for good, but the good news is it's controllable. You go in to see your healthcare professional, dentist or hygienist, they do a professional cleaning, and they show you how to clean. And we also tell you about the signs of gum disease.
What are they?
Like bleeding gums, that's a sign of gum disease. The redness and puffiness of gums.
Okay.
Chronic bad breath is another sign of gum disease. And the other really hard thing for people to understand is a lot of times you can have no signs, no symptoms.
Really?
And have gum disease.
And your gums won't hurt when you're brushing your teeth if you have gum disease and don't know it?
No.
Why?
Well, because it doesn't cause a lot of pain until it's really bad, sort of like high blood pressure. You can't get people to take their medication and say, well, I feel fine. After they have a stroke, they'll take it every day.
Yeah, but then you've hurt yourself. Right. I believe in preventive medicine.
That is correct.
That's what I believe in. You know, if the doctor says no, I don't listen to that. I do what I feel is the best thing for me.
And you're right. So that's what we try to do. So the biggest problem is getting people to come in every 6 months to have their gums checked. And if it turns out that you do have gum disease, you get a series of treatments for the gum disease. And then after we've treated you and got you under control, not cured, then we request that you come in for a recare appointment, which is every 3 months.
Okay, every 3 months. Another question. I have some friends who have just been found out with osteoporosis, bone loss. Can that bother their teeth as well?
I think it would make it worse if you're already losing bone.
Right.
Yeah, and you have uncontrolled gum disease. And also people with diabetes. If their diabetes are uncontrolled.
Is that both types, type 1 and type 2 both?
Type 2 is worse. Yeah.
Type 2, yes, because we give that to ourselves.
Yes, I would think. And I'd have to do a little research on that to tell you the truth, but I know it can accelerate the process
My gosh.
when you have uncontrolled gum disease.
Well, I think if your mouth is hurting, you run to the dentist.
Yeah, well, it doesn't hurt much. A lot of people we get to come in have the 3 stages of gum disease: mild, moderate, and severe. A lot of people we see have already in the moderate stage, they've already started bone loss, especially if they're about 40 years old.
And there's no way to replace that unless you go for a dental implant and a new tooth or something.
Yeah, but you don't want to get there because
you don't want
your teeth work better.
Yes, teeth, our own are much better.
Yeah,
much
ours
better.
are better. The ones God gave us, they're better.
True.
And so I like to work with those as much as I can. And once we can't do anything with those, then we will go to an implant maybe.
But try to save what you have.
Oh, yeah. It just works really, really well.
Right.
And gum disease is the major reason people lose their teeth. And it changes your appearance.
Yes, it does.
How food tastes.
Yeah, you can't chew.
Everything. Like people who smoke.
Oh, my God.
They're at much greater risk.
Can you get gum disease from smoking cigarettes?
It increases your chances of having gum disease if you smoke.
I be darned. Because I know so many teenagers smoke a couple of packs a day.
Yes. Yes. Oh. It definitely increases your chance about threefold. If you smoke.
Oh my gosh.
And if you actually do get gum disease and you're still smoking, your chances of controlling and treating the gum disease are greatly diminished.
Just kiss your teeth goodbye then.
A matter of time, pretty much.
Just pretty much.
Yeah.
That's been exciting. I've learned so much. And I know so many people who are going to watch this are going to ask. So, number one, anyone can get periodontal disease.
Yes.
Any certain age.
Yes.
Even young children can get it.
Even teenagers and kids.
Teenagers and kids.
Yeah, they'll get gingivitis.
Okay. And when then you say the only way to save that is by having having your teeth cleaned like every 3 months. That's 4 times a year.
Yeah, once you get treatment, and that's for the periodontitis, which is the bone loss.
Okay.
Those people need 3-month recall.
Now, does healthcare insurance cover that many cleanings? That's what one lady said to ask you.
Some do. Some actually do, but what you have to do is actually come in and get the series of gum treatment done, and then we code your next visit in 3 months to show that you had the gum treatment, and now we're following up, and you've agreed to do that. And quite a few do pay for that.
Okay.
Yeah, quite a few do pay for it.
They'll pay for it out of your insurance, is what
Out
you're
of your
saying.
insurance, yes.
Do you have anything else you'd like to talk about the heart disease part or anything for the due to periodontal disease?
Well, it also affects your lungs. Well, it's all parts of the body.
It goes to your whole body.
Yeah, if you have gum disease and you have all this bacteria in your mouth, you're breathing in bacteria into your lungs as well.
Right.
And especially if you're a compromised patient and you're not in good health, you can get pneumonia, bronchitis, or it contribute to those things. It won't cause them by itself, but it can contribute to those things. And emphysema.
Emphysema, oh my gosh.
Yeah, it's a
so gum
contributing
disease can be a killer.
I think it affects more parts of the body than anything I can think of.
Really?
I can't think of another disease that affects the body so much.
It runs rampant.
Yes.
Do we have another DVD or something we were going to watch?
Yes, and this will show you some of the destructiveness of the
Please do.
Gum disease.
Researchers have discovered that if you have periodontal disease, you may have an increased risk of coronary heart disease, stroke, and infective endocarditis. Periodontal disease is an infection of the teeth, gums, and bone that surrounds your teeth. It's caused by the bacteria that live in the plaque that forms constantly on your teeth. The bacteria infect the tooth roots and cause pockets of infection to form in the gums, resulting in red and swollen gums that bleed when you brush or floss. Even with early periodontal disease, bleeding gums can create an open doorway that allows harmful bacteria to enter your bloodstream. More advanced periodontal disease can be even worse. It can be compared to a 9-square-inch open wound around your teeth, offering significant opportunity for harmful bacteria to enter your blood. Research indicates that the bacteria associated with periodontal disease may cause inflammation in the arteries, and this could lead to the buildup of fatty deposits and the formation of blood clots that can block your arteries and even trigger a heart attack. These deposits may also build up in the carotid arteries within your neck. In serious cases, if these fat deposits break apart and are carried away in your bloodstream, they can lodge in your brain, block a blood vessel, and cause a stroke. Additionally, some studies have also shown that when plaque bacteria enter the bloodstream through infected gums, you can develop a heart condition called infective endocarditis. This is a potentially fatal bacterial infection that inflames the sac around the heart, the valves of the heart, and the heart muscle itself. So as you can see, it's vital to your overall health, as well as your oral health, to keep your gums healthy. If we determine that you have periodontal disease, we'll see you for frequent professional cleanings, and we'll work with you to create a suitable oral hygiene routine.
That was quite a tape.
I'm glad you remember. I forgot about it.
I really enjoyed that tape, but it scared me too. It really frightened me. Because I know of people who have children 2 and 3 years old, and I think the babies should have his little teeth start brushing, like maybe 6 months. You know, they like to start playing and things like that. But don't let them go until they're 5 or 6 to go ahead and brush your teeth. That's too late.
Yes, yes.
Oh gosh, that was eye-opening. What else you was going to talk to me about?
Well, what I want to tell you is also the treatment for gum disease is what we call subgingival scaling and root planing. And what we do is take an instrument and we remove the tartar above the gum.
And under the gum too,
and
don't
under the
you?
gums, yes. And by removing the plaque and tartar, we remove the bacteria.
Exactly, because that hides.
Yeah, it hides, and you can't remove it.
No, you can't. You can't do it with brushing. It's impossible.
Yeah. So that takes about 4 visits to do, 4 separate visits to complete gum treatment, and that's the initial phase of doing the scaling. And once we get that under control, and even if it's really bad sometime, and you can't do it alone with scaling, sometimes we'll put people on an antibiotic to aid the body in healing along with the scaling.
Yes, because if it's going inside, getting to our heart and our lungs, we should be treated with antibiotics.
Yes, yeah. Don't always have to do it.
This is serious stuff.
Very, very serious.
I mean, people maybe think, oh, that's nothing, I don't have it.
Yeah.
But even if you brush your teeth and your mouth bleeds, that's not normal. That is not normal.
No,
There's
it's not
something
normal.
going on with your gums.
Well, you need an oil checkup just like you need a medical checkup.
Exactly, like a pap smear. I had one last week. But I mean, you go because you want to make sure you're healthy.
Right, that's
you
exactly
want to catch something right away.
Yeah, and as you said, everything is related. If your mouth is not healthy, then your heart, your lungs, your kidneys, your blood vessels.
What about your intestinal tract?
That too,
It
because
takes-
you're ingesting all that stuff.
Oh.
See, the gum disease causes an exudate, better known as pus.
Ugh.
Okay, so you're
okay.
actually swallowing that all day
my
into your
God.
system.
Can that cause congestion in somebody's head who think they have allergies or something?
The discomfort can.
Okay.
That's sometimes confused with pain in the head. If you have pain there from severe gum disease,
Right.
yeah, it is. It's hard to tell if it's sinusitis or a tooth.
This is some big stuff.
Yeah.
Just the little words, you know, what it's just so scary when you see pictures like that, you know. Everybody out there better do something. They should
Listen to Angela.
Come see you. Get your gums cleaned. Oh, it's awful.
Well, that would be great. I love helping people.
I know. I like having you on here because you're honest.
Thank you.
I'm a very honest person. I see that in you. You're not some
Thank you.
highfalutin dentist out there wanting to take everybody's money. You're not.
No,
I sensed that as soon as I met you. You have very
Thank you.
kind eyes.
Thank you.
And I trust you. And on that note, I'm going to have to call this show to an end. And in the beginning, I called you Reginald, but it's Ricardo. Thank you, Dr. Ricardo Jones, for coming here today.
And you're
I've
so
had a
welcome for
ball.
having me.
I've had a ball.
I have a ball every time I come.
Okay. Thanks for watching. Until next time.